Hello, my name's Nicole. I'm going to be your nurse today. What do you prefer to be called?
Patrick.
Okay, great. Do you know what day it is?
It is Wednesday.
Okay. Do you know what big day is coming up?
Thanksgiving.
And do you know where we are?
We're at Stark State College.
And do you know what year it is?
2016.
Okay, great. Thank you. All right, I'm just going to be doing a little exam.
Okay.
All right. I'm going to have you open your mouth for me. Okay. And I'm going to check your eyes. If you could just look at me, but try not to look into the light.
Okay.
All right. Pupils are equal, round, and reactive to light and accommodation. Everything appears to be symmetric. Mucous membranes are moist. Okay. I would do your vital signs and listen to the apical pulse for 1 minute. Patient doesn't appear to be in any signs of distress. Skin appears to be pink, dry, and warm. I'm going to go ahead and check your capillary refill.
Okay.
All right, capillary refill is less than 3 seconds, which is normal. All right, I'm going to go ahead and go on to listen to your lung sounds, and I'm going to listen to 10 in the front and 20 in the back. And you could just go ahead and breathe normal for me.
Okay.
Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. If you could just go ahead and lean forward for me, I'm going to listen to 20 spots on the back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Breath sounds are fine. If I heard any wheezing, I might suspect asthma. If I heard any bronchi, I might suspect pneumonia. Everything seemed to be fine. Okay, I'm going to go ahead now and I think listen to your heart sounds. All right, for the aortic, I would listen to the right second intercostal space. Oops. And then for the pulmonic would be the left second intercostal space. Erb's point would be the left third intercostal space. Erb's point would be the left fourth intercostal space. And then for the fifth intercostal space, that would be the mitral valve, and that would be towards the mid-clavicular line. And if I hadn't already listened to the apical pulse, I could do that now for 1 minute. Heart sounds are within normal limits. Do you have any lesions or wounds on your skin? Okay, everything appears to be fine. And go ahead and listen to your bowel sounds. I could also check for abdominal girth by starting at the navel and measuring around. Sometimes we do that to check for ascites, which could mean possible liver failure. And I could also check for JVD, which I would lay the patient at a 45-degree angle, and I would check for fluid overload, which could indicate right-sided heart failure. All right, and now for bowel sounds. And when you're checking bowel sounds, you always want to do from the right lower. And then you'd go right upper, left upper, and left lower. Patient has bowel sounds present in all 4 quadrants. All right, and now I'm going to go ahead and check your peripheral pulses. I would do the carotid and only one side at a time. I would move on to the brachial, and then radial, which would be thumb side, ulnar, which would be the pinky side. Femoral is the groin area, popliteal behind the knee. Dorsal pedis is the top of the foot, and then posterior tibial would be the inner portion of the ankle down a little lower. Pulses appear fine. I would check for edema. It's fine. Skin turgor. No signs of dehydration there. Okay, and I had already checked for capillary refill. So while I was listening to bowel sounds, I would check tympani, which that would be for percussion, and it's a high-pitched drum-like sound that you would hear, and more over gas-filled areas like the stomach or intestines. And dullness would be also a high-pitched sound, but more of a thud-like, and that would be over dense, solid areas like the liver. And I would also check the lymph nodes to see if there was any swelling, which could be indicative of some type of infection, but I do not notice that at this time. While doing the cardiovascular assessment, the point of maximum interest or impulse is between the 4th and 5th clavicular, mid-clavicular of the intercostals, and I would listen to that in between doing, before or after I did the mitral and tricuspid. All right, now I'm going to check your vision. If you could just follow this pencil and try to actually follow the pencil without moving your head. Okay, up and down. Okay, side and back, side. Okay, Chris, cross, and one more time, Chris, cross. All right, it appears to be fine. While checking for vision loss, if I had a tuning fork, I could check for Rhine, which would be striking the tuning fork and placing it behind the ear, and Weber would be striking the tuning fork and placing it on the forehead, and that would be for checking for high-pitched hearing loss. And now on to neurological. If you could go ahead and squeeze my fingers for me.
Yep.
Okay, very good. All right, and push on my hands. Good. All right, and I'm going to put my arm over yours and just try to lift your arm. All right, very good. And while I'm here, I'm going to go ahead and ask you about your bowel habits. Do you use the restroom regularly?
Yes.
Do you have any difficulty with bowel movements?
Not at this time.
And how often do you usually have a bowel movement?
Oh, maybe once a day or once every other day.
Okay. And how about for voiding? Do you have any difficulties there?
No difficulty.
Okay, no difficulty with starting or stopping the stream?
No.
Okay. And do you perform a testicular self-exam?
Yes.
And how often do you do that?
Usually once a month, and I do it right in the shower.
Okay, great. I just cannot stress the importance of that. Make sure you continue to do that, and if you find any irregularities. All right, we're going to go ahead and do the heel to toe. Are you familiar with this?
Yes.
Okay. If you could just go ahead and walk to this line for me, heel to toe.
Okay.
All right, and if you could turn around and walk back then. Thank you. And now I'm going to do the Romberg test. I'm just going to have you close your eyes.
Okay.
I would just be checking to see if the patient was swaying in any way, and you want to make sure you stay close in case they would fall. Okay, very good. Everything appears to be normal. And muscle strength is usually graded from 0.5 to 5 for 5. Patient has 5+, which would be normal.
Ms. Patrick, I'm going to be your nurse today. How are you?
Good, how are you?
Good. Can you please state your name and your birthday, please?
Nicole Jones, 2/11/81.
Okay. Do you know where you are right now?
Yes, at Stark State.
Okay. Do you know what good holiday is coming up?
Thanksgiving.
All right. All right. Okay, at this time, I'm going to get her vitals. They are within normal limits, and I would get a apical pulse within 1 minute. All right, at this time, I am going to examine your eyes.
All right.
Okay, just look forward for me. Good. Good. That's Perla. And then I am going to have you stare at my finger and just watch my finger as it goes. Very good. Everything is within normal limits. And if I wanted to test the hearing, I'd do the Ryan and Weber test. I would have a tuning fork, hit it just to see if there is any kind of hearing deficits or any kind of deafness or any problems with high frequency sounds. Okay, and I'm going to have you open your mouth for me, please. Okay, mouth is pink moist and mucosa is moist. And I'm going to move down to the neck. I'm going to check the carotid, not both at the same time. Okay, pulse is present. I'm going to check for JVD. If there is JVD, you want to make sure that they're sitting up at a 45-degree angle to check to see if there's any kind of fluid overload. Okay, and whenever I am at the neck, I'm going to check also for any kind of problems with their lymph nodes to see if there's any kind of swelling, to expect any kind of inflammation or infection. Okay, I'm going to move to your lungs, and I'm going to listen to 10 on the front and 20 on the back. You could just breathe regularly for me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Breath sounds are present. They are symmetrical. And if there is anything wrong, such as crackles, could represent congestive heart failure or pneumonia. And if there is any kind of wheezing, could expect some kind of asthma. Okay, I'm going to have you lean forward for me. Thank you very much. I'm going to check 20 in the back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. Okay, very good. Thank you very much. It is symmetric in the back as well, and no crackles or rhonchi. Okay, now I am going to move to your heart sounds.
Okay.
Okay, I am going to start with the right second intercostal space, or your aortic. I'm going to move to your left second intercostal space, which is your pulmonic, and then your left third intercostal space, which is your Erb's point. Then your fourth intercostal space, which is going to be your tricuspid area. And then I'm going to move to the fifth intercostal space, which would be your apex. Okay, good. Within normal limits, the heart sounds pretty good. Okay. Now I'm going to move to the stomach, and I'm going to check for bowel sounds. I want to start with the right lower region first, then the right upper, then the left upper, now the left lower. Bowel sounds are present. If you want to check for abdominal girth, you start from the navel, work to the sides. How often do you usually have bowel movements?
About every other day.
About every other day. Is there any kind of problems?
No, everything seems to be working fine.
Okay. Also, you whenever you want to percuss, if there's any kind of sound of hardness or dullness, that represents that it's going to be a solid. If there's going to be a tympanic or like a hollow sound, it's going to be hollowed or a gas. Also, how often do you void?
A few times a day, I'm sure.
Okay. Do you know what the color usually is?
Like a lighter yellow.
Okay. All right. And there is no problems. I don't know.
No problems yet.
Okay. All right. Well, I'm going to check all the different kinds of pulses. You have your carotid. You don't want to check them at the same time. You want to check your brachial. And then you want to check your radial on top of the thumb. Both are equal. Check the ulnar. Both are equal. You want to check the femorals. Now popliteals you want to check right behind the knees. Good. Present. Then you want to check the dorsal pedis, which is right on top of the feet. Then you want to check the posterior tibial, which is right by the backside of the inner ankle. Present. Very good. Both are equal. Then you want to check if there's any kind of edema in the arms and the legs. There is no present. Do you have any scars anywhere?
No.
Or any kind of lesions? Okay, good. You want to check also the skin color, which is pink, warm, dry. You want to check for turgor in the hands. Rebounds right back. You want to check for a capillary refill in both fingers. Less than 3 seconds. That's very good. And you want to check also for the feet as well. Can you squeeze my fingers for me?
Sure.
Very good. Also, do you want to press up on my arms? Okay. Press down. Very good. Okay, I'm going to have you do a dorsiflex and plantar flex. At this point, I'm going to have the patient do a heel to toe. I'm just going to have you stand at the edge of the bed, and then I'm going to have you go 1 foot heel to toe right in front of another.
Okay.
I begin. Very good. Can I have you stand at the edge of the bed?
Sure.
Thank you. I'm going to have you put your feet together, and I'm going to have you close your eyes. I'm going to do the Romberg test. This is when you want to check for proprioception, see if there's any kind of excessive swaying, to see if there's any kind of a fault in some kind of equilibrium. All right, very good.